Have you ever wondered? Hello everyone, welcome back to Inquisitive Creation. My name is Gilo, and I will be your trusted companion to explain things you ever wondered about but does not exactly know what they are. Today, we're diving deep into the complex world of pain management. Specifically, we'll be shedding light on opioids, their benefits, risks, and most importantly, safer alternatives that can provide effective pain relief without the dangers often associated with opioid use. Let's embark on this journey together. Pain is a universal experience, and finding the right approach to manage it is crucial for our overall well-being. Now let's talk about the different types of pain. Ongoing or recurring pain for 3 or more months has been defined as chronic pain. In comparison, acute pain can have an abrupt onset and is usually short-lasting. Chronic pain problems usually manifest initially as acute pain, and many chronic pain conditions are associated with an intermittent acute flare-up of pain. Chronic pain is a widespread health problem, with approximately 100 million people in the United States suffering from chronic pain in 2008. About 13 to 50% of adults in the United Kingdom have been estimated to suffer from chronic pain. This leads to a significant economic toll through direct healthcare costs associated with treatment and lost productivity. The estimated economic burden ranged from $560 to $635 billion in 2010, which is much higher than that of diabetes, cardiac problems, or cancer. Now, opioids have long been a cornerstone in pain management. However, their potential for addiction and other adverse effects has raised significant concerns. So, what are opioids, and what are the alternatives to opioids? Opioids are a class of drugs that work by binding to specific receptors in the brain, spinal cord, and other parts of the body known as opioid receptors. These receptors are primarily involved in modulating pain perception, but they also influence other functions such as mood, breathing, and gastrointestinal activity. When opioids bind to these receptors, they activate a series of biochemical reactions that ultimately result in a reduction in the transmission of pain signals along the nervous system. While they can be highly effective for managing severe pain, they also come with serious risks, including addiction, overdose, and withdrawal. The United States, in particular, has been grappling with an opioid epidemic, one characterized by skyrocketing overdose deaths and widespread addiction. In 2016, prescription opioid misuse was found in at least 4% of the United States adult population. More than 33,000 people died due to opioid overdoses in 2015, both prescribed and illicit. When you take opioid medication for a long time, your body becomes desensitized to the effects. Over time, your body needs more and more of the drug to achieve the same effect. This can be very dangerous and increases your risk of accidental overdose. Prolonged use of these drugs changes the way nerve receptors work in your brain, and these receptors become dependent upon the drug to function. If you become physically sick after you stop taking an opioid medication, it may be an indication that you're physically dependent on the substance. Withdrawal symptoms are the body's physical response to the absence of the drug. Nausea and vomiting can be significant symptoms during the withdrawal process. Inadvertent breathing of vomited material into the lungs can be a serious complication associated with withdrawal, as it can lead to the development of pneumonia. Diarrhea is another very uncomfortable and potentially dangerous withdrawal symptom. Loss of fluids and electrolytes from diarrhea can cause the heart to beat in an abnormal manner, which can lead to circulatory problems and even heart attack. It's important to replace fluids lost to vomiting and diarrhea to prevent these complications. Even if you don't experience vomiting, nausea can be very uncomfortable. Muscle cramps and joint pain can also be present during opioid withdrawal. As many of us can appreciate, opioid withdrawal can be very uncomfortable. And many people continue taking these drugs to avoid unpleasant symptoms, or they try to manage these symptoms on their own. However, medical treatment in a controlled environment can make you more comfortable and lead to a greater chance of success. Now, the opioid crisis has underscored the urgent need for safer and more sustainable options. There are also various non-narcotic pain medications that can work to effectively manage your pain. Most of these are available over the counter and are much safer than opioids. Understanding which medications are used for which conditions is the key to using them effectively. Here are 10 of the most common alternatives to opioids. 1. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs work by inhibiting the enzyme cyclooxygenase, thereby reducing the production of prostaglandins, which are inflammatory mediators involved in pain and inflammation. Examples are ibuprofen, naproxen, and aspirin. 2. Acetaminophen. Although the exact mechanism of acetaminophen's analgesic or pain-relieving effects is not fully understood, it is believed to involve inhibition of prostaglandin synthesis primarily in the central nervous system. Unlike non-steroidal anti-inflammatory drugs, acetaminophen has little to no anti-inflammatory effects. An example of acetaminophen is paracetamol. 3. Corticosteroids. Corticosteroids exert anti-inflammatory effects by suppressing the immune response and reducing the production of inflammatory cytokines. They can be administered systemically like orally and intravenously or locally, via injections into specific joints or tissues to reduce inflammation and relieve pain. Examples are prednisone and methylprednisone. 4. Antidepressants. These drugs can modulate pain signals in the central nervous system by affecting neurotransmitters such as serotonin and norepinephrine. They can also have direct analgesic effects independent of their antidepressant action. Examples are amitriptyline and duloxetine. 5. Anticonvulsants. Anticonvulsants can reduce pain by modulating the activity of neurotransmitters and ion channels involved in pain transmission in the central nervous system. Examples are gabapentin and pregabalin. 6. Topical analgesics. These are applied directly to the skin over the painful area and work by various mechanisms such as desensitizing nerves, cooling or heating the area, or blocking pain signals. Examples are lidocaine patches and capsaicin cream. 7. Nerve blocks and epidural steroid injections. These interventions involve the injection of local anesthetics, corticosteroids, or other medications directly into or near nerves or the epidural space surrounding the spinal cord. They can block pain signals from reaching the brain or reduce inflammation and irritation around nerves, providing targeted pain relief. Examples are epidural steroid injections, facet joint injections, and nerve root blocks. 8. Transcutaneous electrical nerve stimulation. Transcutaneous electrical nerve stimulation therapy involves the application of low-voltage electrical currents to the skin via electrodes placed near the area of pain. The electrical stimulation can modulate pain signals by activating endogenous pain inhibitory mechanisms, such as the release of endorphins, and by blocking pain signals from reaching the brain. 9. Cognitive behavioral therapy. Cognitive behavioral therapy is a form of psychotherapy that helps individuals manage pain by addressing maladaptive thoughts, emotions, and behaviors associated with pain. It aims to modify negative thought patterns, develop coping strategies, and improve overall psychological well-being, which can lead to reduced pain perception and improved functional outcomes. 10. Mindfulness meditation and relaxation techniques. Mindfulness meditation and relaxation techniques promote relaxation, stress reduction, and heightened body awareness, which can help individuals manage pain more effectively. These practices may modulate pain perception by altering neural activity, in areas of the brain involved in pain processing and by reducing physiological arousal. Now, each option has its own unique mechanism of action and may be utilized alone or in combination with other therapies, based on the individual needs and preferences of the patient. Effective pain management often involves a multimodal approach that addresses both the physical and psychological aspects of pain while minimizing the risks associated with opioid use. In conclusion, while opioids have their place in pain management, they're not the only option available. By exploring these different alternatives like non-steroidal anti-inflammatory drugs, corticosteroids, and mind-body techniques, we can better manage pain while minimizing the risks associated with opioid use. Remember, pain relief is not one size fits all. Find what works best for you. Thanks for watching, and be sure to like, share, and subscribe for more insightful content. Until next time, take care. This is your friend Gilo signing off from Inquisitive Creation. Thank you so much for watching.